This is One on One. We're pleased to welcome Dr. Mark Einstein, who is Chair, Department of Obstetrics and Gynecology at University Hospital, and also Chair, Department of OB/GYN and Women's Health, Rutgers, New Jersey Medical School. Doctor, please do not tell me that's all on the same business card.
It kind of is, yes.
By the way, it's Obstetrics and Gynecology at University Hospital.
You got it, Steve, yeah.
Yes. By the way, what is that field?
The field is a comprehensive field of all of women's health. Women's health is not just about contraception and babies. It's about cancer care. It's about medicine that is related to some of the hormones and milieu that women go through that are different than men. It's related to menopause health. It's related to all forms of comorbidities. The number one killer of women is heart disease. People think it might be other stuff too, but it's just as common heart disease in women as it is in men. And we have to do a lot to try to prevent these things.
Well, you and I were talking real quickly before we went on the air about pregnancy, women having children. There are many terrific producers around here, happen to be women, having babies. I don't know to the degree to which I'm like, wow, they work hard. They're juggling all kinds of things. I don't know what they're feeling, what they're thinking. Here's the question. I swear there's one here. Do we even have a clue as to what most women deal with when they're giving birth?
I think women do. I don't think we do. I think
do
women do.
We try enough?
We need to try more. There's no doubt about it. We need to understand really what women are going through. And women, especially the first pregnancy, it can get scary. There are a lot of changes. There are a lot of challenges that happen. And, you know, it's the fear of the unknown, even the fear of just the process of the whole pregnancy process and the labor and the delivery. I mean, that could be a fearful process. I think with a lot of education, talking to your providers, it'll help kind of demystify it. And this is, I think, where the community sort of comes in too. I mean, one of the focuses that we have at University Hospital is we have a centering pregnancy program where instead of having each woman talk to their provider for like 8 or 10 minutes, it's a group of women talking to a provider for 2 hours. And they're all talking, they're all asking questions. And guess what? The one that doesn't say anything over here, the one asks the question over there, you know, that was my question too, you know? And it kind of brings that community together. And I'll tell you, our patient satisfaction is very high with these centering pregnancy programs. This is a movement that is taking one, especially in urban and multicultural sort of areas of the United States, such as Newark, which is a very multicultural area.
Let's talk about the mother-baby connection. You have a mother-baby unit? Mm-hmm. Talk about it.
Yeah, so we have a lot of changes going on at University Hospital. It's we just renovated our labor and delivery unit, and it's exciting because it's a state-of-the-art unit, and it's not just the book cover, but it's the content that's in the book. We have experts that surround patients with a blanket of care, and they come from all cultures, and a lot of them come from the Newark community. And so they understand the other aspects of their care that goes into their health and goes into the quality outcomes that we want to achieve. And
Doctor, what does it mean to be baby-friendly?
Baby-friendly is a World Health Organization designation that says that a hospital it recognizes the role of breastfeeding right from delivery. And University Hospital is the first hospital in Essex County to establish this designation. It took us 3 years to get to this point. 90% of moms are leaving University Hospital breastfeeding, which we are very proud of. Why is breastfeeding best? Well, it's because it decreases a lot of disease. It decreases allergies, it decreases asthma, and we've learned that it ultimately leads to like the best outcomes.
It's so interesting. People think they understand the value of breastfeeding, but there's so many pieces to that. By the way, go on the website to find out more information. The other piece of this is the whole question of reducing the number of C-sections.
Yeah.
Because?
Yeah. Well, the C-section rate in this country has risen dramatically, and it's complicated. I mean, some of it is.
But it's just too high.
It is too high. It is too high. And ACOG, that's the American College of Obstetricians and Gynecologists, say the best mode of delivery is a vaginal birth. I mean, let's face it, moms have been having babies long before they were obstetricians,
that's
long
right.
before there were healthcare providers, even long before there were midwives and doulas and all the other affiliated healthcare personnel. C-sections, though, are necessary for a lot of pregnancies. There's no doubt about it. And so I think part of an obstetrician's job is to know when to be doing that and know when, sometimes the obstetrician's best friend is a warm, comfortable chair. And this is what we need to be doing more of. And we have actually the lowest C-section rate in New Jersey at University Hospital. I love it.
Because?
Well, first of all, I love making a difference in the lives of my patients. I love feeling that their health outcomes are really going to be improving. My clinical work is actually in gynecologic cancers. So I'm a cancer surgeon, and I administer the chemotherapy. And so for me, I'm sometimes dealing with a lot of decisions between bad and worse. And while I don't make their disease, I like to help guide my patients to know where they're going and provide them with sort of the next level therapy. I mean, some of the things that we're doing even now at University Hospital, we now have a relationship with Rutgers Cancer Institute in New Jersey, which is the state's only NCI-designated comprehensive cancer center. And through this, we're actually be able to provide novel therapies, novel treatments in our backyard to the patients in Newark. So they're not only seeing what are the innovative therapies of today, but they're seeing the innovative therapies of tomorrow. And it's exciting.
Doctor, thank you for everything you do every day.
Thank you.
Particularly for the women in our lives. Thank you.
Thank you.
Stay right there. We'll be right back right after this.
One-on-One with Steve Adubato has been a production of the Caucus Educational Corporation, celebrating over 25 years of broadcast excellence. Funding for this edition of One-on-One with Steve Adubato has been provided by Delta Dental of New Jersey, the Healthcare Foundation of New Jersey, Kessler Foundation, the New Jersey Reentry Corporation, New Jersey State Nurses Association and the Institute for Nursing, New Jersey Sharing Network, and by Community Food Bank of New Jersey. Transportation provided by Airbrook Limousine, serving the metropolitan New York, New Jersey area. One-on-One with Steve Adubato has been produced in partnership with TriStar Studios.